Okay. Nadia, can I start? Okay, I think we're going to just start. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. This is Ardi Findiartini from Medical Education Center, Indonesia Medical Education and Research Institute, Faculty of Medicine, Universitas Indonesia. Welcome to the webinar series on COVID-19 education adaptation. And today we have renowned speakers, and we're going to discuss student and faculty well-being during COVID-19 pandemic. So we have Professor Judy McKimm from University of Swansea. Good morning, Judy. It's morning there, I know. Thank you for joining us. And we have also Prof. Kirsty Forrest and Dr. Joe Bishop from Bond University, Australia. Thank you very much for joining us, Kirsty and Joe. And we have also two speakers from Faculty of Medicine, Universitas Indonesia, Dr. Vera Nindya and Dr. Patrin. So today we are going to have, I believe, very interesting discussions. So to all participants, we would like to share our gratitude that you have, some of you have filled in the questionnaire. And we hope that in this webinar we can discuss and more importantly, reflect on ourselves, whether we've been taking care of ourselves well. And we have in our participants the faculty, academic staff, and also students. And everyone is welcome to ask questions to the resource person through the chat room. So I would like to, before we move on, the sequence of the webinar will be the presentations first will be shared by Prof. Judy McKimm on the concept of the well-being overall and why is it important, and following by a presentation by Prof. Kirsty Forrest on the well-being of the students, and then followed by Joe's presentations on the well-being of the faculty or the staff, and followed by combined presentations by Dr. Vera Nindya and Dr. Patrin from our psychiatric department in Cipto Mangunkusumo Hospital, Faculty of Medicine, Universitas Indonesia, on what has been done in our teaching hospital. So before we move on to the presentations, I would like to share the results of the questionnaire. So we have 89 respondents, 89 responses, and it's quite alarming, but we hope that by the end of this webinar, we can identify or we can explore more optimistic feelings. So there are, based on this questionnaire, there are quite prominent psychopathological conditions among the respondents, 78%. And if we see further, there is the some alarming signs, not signs, probably potential signs on depression, anxiety, some somatic manifestations, and also some energy reduction. So the things that probably I think all the speakers can also use this data to see that actually the problem in our well-being during this COVID-19 pandemic is real. So, and we would like to also share that we, through the confirmations email to all registrants, we would like you to describe your feeling during this COVID-19 pandemic. And these are your feelings, the wordle that our team has developed. So some happy feelings, positive feeling, and optimistic feelings, and some sad feeling, difficulties, confusion, ambivalent, and etc. So I think we can really relate to all of these feelings, and that's why it's always. I think I'm going to quote you, Joe, that it's okay not to be okay sometimes, and it's very important to recognize our feeling and how we can still function in these very difficult times. So without further ado, I would like to invite Judy to start the presentation. Judy, time is yours.
Thank you very much for inviting me to this webinar. I think it's really important, and as we've seen from the Wordle, psychological well-being is really important. So I thought I'd start off with defining really what well-being is. Well-being is the experience of health, happiness and prosperity. So it makes us feel good about ourselves. It includes good mental health and a good satisfaction with our life overall. Really important is a sense of purpose or meaning to our life, and also an ability to manage stress, but it's generally just feeling well. And it has 5 different types, and I think we've seen those on the Wordle really as well, and what we've seen in the survey. So emotional well-being is about that feeling good, basically, being a bit resilient, but it's tied very closely to our physical well-being, how we feel in ourselves, how we communicate with other people, how we develop relationships and maintain a support network. Really important for the pandemic, that helps you overcome loneliness. Humans are primed for connectivity, we're social beings. In the workplace, again, you know, that's been affected by COVID-19. And in the workplace, we get a lot of meaning from our interests and values and enrichment. And then also we want to actively participate in our community, our environment. So there's a deep psychological response to COVID-19 that everybody will be experiencing. And it's very primal. It's actually very neurological. If we see here, our little COVID-19 viruses are coming into us. These are the sensory stimuli. We have fear. We feel the presence of it, even though we can't see the virus, and the effects that it has on us, perhaps working from home or not seeing our friends or our family, affects our brain, our cerebral cortex, but it also affects the amygdala, the very deep part of our brain. And what that occurs in us are these emotional responses, and the primal ones, often when we have a reaction to what we see a crisis, are sadness, loss, fear, and sometimes anger. So these emotional responses occur in all of us. You know, we can be frightened about it. So here, another Wordle. As the virus is all around us, we end up with anxiety and sometimes panic attacks. We've seen some people feel depressed, feel lonely, feel frightened, feel stressful. And these are the negative effects that we experience. So along with that, what we're experiencing, as well as this sort of fear and this primal response, is a response to change. And this is the human response to change. This is taken from Kubler-Ross's cycle of grief and loss. But actually what we have in the early stages is we have this relational response. We have some shock and denial. Is this really happening to us? And then that leads to the emotional response that I showed you on the earlier slide: anger, sometimes blame, bargaining. Here we're concerned for the past. We're concerned with what we're potentially losing. Where if we have to work from home, we're losing perhaps our friends, connection with our family, you know, seeing our gathering together, all our usual daily routines we've lost, and we can turn into a stage of apathy. You might call that might lead to depression, but certainly it suppresses our emotions. Then gradually, as we're looking to the future and what we might gain from this, the opportunities, we move up into the higher part of the cycle, and our performance starts to raise again. But there's always this response to change. It's a psychological response. In terms of thinking about ourselves, our students and our faculty, this goes back to the early days of humanistic psychology. And what we see with Maslow's hierarchy of needs, that these are the basic needs. We need to feel safe. We need to have our physiological needs met. But in terms of the psychological needs, which are these ones here, We need these intimate relationships. We need to belong. We need to feel some feeling of accomplishment. We can't get to that stage until we've got ourselves out of that cycle of grief and loss. Okay, so we need to get up off the apathy and start towards that acceptingness by building these needs up. So actively seeking connectivity. It's very easy to just relax and go into your own shell, but it's making those connections. So Tony Robbins also talks about human needs in a slightly different way, and I think this is quite helpful. We have these needs about certainty, but also we need some variety, and we've got a paradox here. So certainly for myself, you know, I need to know what I'm doing day to day. But one of the things that struck me working from home, we're in our 7th week now, is that I haven't got the variety that I have at work, seeing different people. So that need for me is not been met. I need to think about meeting it for myself. We need to feel significant as individuals, but we also need to feel part of a community and have connections. And only then can we actually start to grow and contribute. So thinking about these needs then, one of the things that we need to think about for ourselves and for our students and our faculty is we need to think about drawing on that resilience. Now, resilience can be seen in various ways, but I like this idea of the continuity of the personal narrative. It's maintaining your sense of self. So if we're suddenly thrust into working really differently, or our life is really differently, sometimes our sense of self can get disrupted. You know, we're not the academic, the professor, the whatever we are. And of course, people vary as to their tolerance of these adverse events. It can be their stage of life, their previous experiences, but also how they see the event. And your resilience and your tolerance will naturally fluctuate. So at the beginning, when we all worked at home, it was actually quite exciting in a way because it was different. But in week 7, for me, I'm probably going to be at home now till September working from home. This resilience is really hard to keep up because there's no variety, as we've said, with that human need. So our resilience draws from various areas. It draws from the physical, really important to maintain our fitness throughout these crises. Our self-belief, our outlook, I'll come on to that in a minute. Our values, beliefs and sense of purpose, that can be a religious or a spiritual or just our human sense of meaning, but also that emotional response. And I'll come on to emotions in a minute. So if we can start developing resilience in ourselves and others, this is really important, taking care of ourselves, building strengths, learn from your mistakes, and really important to find time for some reflection, but also this reflexivity and restoration. So give yourself a break. I think that's really good advice. You know, if things are just getting a bit too much, go for a walk if you can. I've got dogs, I take them out for a walk to the beach if I get a bit stressed. But your response and your reaction is actually in your control. And that's really hard for us when we're feeling really down or fed up. That's really hard for us to tap into. So one of the things to think about the things we can start to develop, Martin Seligman's work is about learned optimism. It's this positive approach, positive psychology. So we're moving from humanistic psychology now to positive psychology and that genre of psychological theory. And he talks about the Perma Model. So the P is positive emotions, really tapping into those. Things like gratitude is really important, or just trying to, be mindful. Try and get into some engagement with things. Find a task that draws you in and makes you happy and gets your mind moving on that. Build these relationships, maintain them. It can be really easy to drop relationships if we're not careful when we don't see people on a daily basis, but maintaining that. And then finding some sense of meaning and purpose. This is at the root of all our human needs. And then trying to tick some boxes off, even if it's a tick on the whiteboard of things you've achieved. That gives you some small sense of achievement and helps to lift your mood. So one of the things that they talk about in this positive psychology, and we talk about people, some people are much more optimistic in nature, some people are more pessimistic, but actually this movement about thinking things are permanent, pervasive, personal and uncontrollable is unhelpful. It pulls us down. Whereas if we can put ourselves in the mindset of thinking, actually, this is temporary. This COVID seems like it'll go on forever, but it will pass. It will pass in some way. It's local. Actually, it is a situation. Okay, a global pandemic does seem as if it's everything, but you know, it's one situation that you're in. It's not personal. Okay, this is not your fault that this has happened, and there's something you can do. So it's finding the things you can control and that you can take forward. And along with that, I think Angela Duckworth's work on grit, this idea of finding your long-term goals, tapping into your passion, tapping into your perseverance. Again, once you've got out of that low point of the change curve, that's really important. But also having this growth mindset. This is Carol Dweck's work. Thinking about, actually, let's take a challenge. So some of the things we've been doing with these webinars is a challenge, and it's pushing us forward, trying new things. So trying to get that growth mindset, nurture that in your students and your faculty. And along with that, you know, we need this emotional intelligence. This is Daniel Goleman's work. So this is just a cartoon, you know, this is leadership training. Yes, I knew that listening was crucial to being a good leader, but I never knew that I was the one that had to do the listening. Okay, so this is important. Listen to people, hear what they're saying, listen to yourself. And of course, thinking about that emotional intelligence, one of the parts of that is self-regulation. And if you're talking about integration, this is from a Canadian model, this integrative perspective, we're sort of back to where we were. We've got our mind and our spirit, tapping into that, thinking about our body and our behaviors, making sure the systems and structures around us work. So having the things that we need around us to make that work, and putting policies in place in our universities. And the culture is really important. So building that culture within our teams and within our groups. And tapping into something that Kirsty shared with me a couple of years ago, this is Daniel Coyle's work on the culture code. And this is really important, I think, as faculty for the teams we're leading, you know, building some safety, sharing vulnerability, establishing purpose. And I think this sharing vulnerability, we are all humans and we're all in the same boat. Okay, our boats might be different, they might be going in different directions, but it's the same boat. And I think then that taps us into some of the behaviours that we might model, showing respect for others, recognising people's input, even if they're at the bottom of the change curve and their input is tiny, recognising that people are moving through that psychological shift, being responsive to people's needs and taking responsibility. But it's on both sides. So we need both from both our leaders and the people that we're working with. And I think then that leads us on to thinking about, as leaders, as faculty, how might we work? So empower people, okay? Have that intellectual humility. We're all new to this. This Zooming and all these things is new to us. We haven't worked like this, all of us, across the world ever. And so let's learn from other people, admit where we go wrong, actually get those people having conversations, have some courage to do what you know is right, even if it takes some risk, and then being accountable for yourself, but enabling people to be accountable for themselves as well. People have to start to take responsibility. One of the things that happens in crisis is that people can start to abdicate responsibility and go inwards. And what we have to do is try to get them to come outwards again and actually start to grow back into the workplace. And one of the things that's really important when we're all at a distance is to make sure that we're giving these little micro affirmations and little cues that value people, a quick email, a quick text, an acknowledgement on the Zoom, hi everybody, you know, it's that sort of thing. What signals are you sending? What signals are you sending out? And really trying to avoid putting people down, ignoring people, marginalizing people, you know, so everything that you would do with your students and faculty, really important to think about that, because from a virtual world, these things can get magnified. If somebody feels that you've ignored them, they can be at home dwelling on that rather than passing you in the corridor and you can sort it out quickly. Well, hi. Oh, sorry, I thought you weren't talking to me. Oh, yes, I am talking to you. How's your dog? Okay, so, you know, these things aren't so easy when we're all separate. And so some of the ways that we can do that in the workplace is working with people to recall positive life events, things that have happened, you know, have those conversations, not just about work, but about loud. Do you remember when we went out that night? That was a really good meal. Acts of kindness, you know, to people around you. Express gratitude. Look at us. We're all alive. We're all here. We're all doing our things that we like doing. You know, that is so important. And some mindfulness, at just reflecting in, taking that time to just explore nature or whatever it is that actually takes us mindfully. So in summary, what I'd like to just say really is acknowledge the psychological impact of change on your others and yourself. It happens, and it doesn't happen once, it will happen in cycles. I had a real dip at the beginning of this week. It was because we were told we were here. I was here till September, not going back into work, and it really hit me. I just thought, whoa, another 5 months of this, not good. Listen to people, observe and assess, and be calm to others, confident and realistic. You could role model that positive mindset. And always try to do something. It won't be perfect, but have a go at things that are a bit out of your comfort zone. Build that safe culture. Challenge microaggressions in others, but watch yourself as well. Practice with intent and heart. I think so important. Be kind. Be compassionate. Okay, you might be the boss and you might want people to do things, and there might be a point where you have to actually have a difficult conversation, but be kind with it as well. And then I think I'll just leave it with communicate, because that builds connectivity and that makes people feel valued. Thank you very much. That's me.
Yeah, thank you very much, Judy.
Thank you. If you can end my slideshow, that's fab. Yeah.
Okay. Let me help you with that. Yeah,
thank
you very much, Judy. Very interesting presentations, insightful as well. I myself, I will post the questions for you. So before we move on, I would like to revise some informations we shared before. So I just want to share the slide again. Yeah, okay. So I mentioned that the psychopathological conditions based on the completion of the SRQ reports is 78% of psychopathological conditions. It's actually the other way around. It's a relief, actually.
Yes,
so
yes, it is a relief.
It's a relief. It's a big relief. So 22% of our 89 respondents. So that's all that I would like to revise. So I would like to welcome all participants. We have also participants from Malaysia, also from Indonesia. So without further ado, I would like to invite Prof. Kirsty Forrest, Dean of Medicine from Faculty of Medicine, Dentistry and Health Sciences in Bonn University. Kirsty, the time is yours.
Thank you very much. I'm very pleased to be here, and I'm very pleased you've invited me, and I'm so grateful to be here and speaking to you. I'm just going to put my video on, sorry. So the next two talks are from myself, Kirsty Forrest. I'm the Dean of Medicine here at Bond University in Australia. And the talk after me is from my colleague, Dr. Jo Bishop. And I'm talking about students' well-being, and she's concentrating on faculty well-being. But we'd like to point out that actually a lot of what we're going to talk about applies across both those different groupings, if you like. And so I think you can take away things for yourself as well as students, and to help students. I know there's some students in the group, and I feel a little sad that actually probably a student should be doing this. I think that would have been a better way to do it. But I would like to tell you how we're doing it here at Bond, and hopefully they'll ask some questions and we can get some discussion going. So normally students, and when I say normally, we're talking about what I like to call BC, so before COVID, and because the new normal is being talked about already, that we're already in. But normally, students that were seeking support did for a range of reasons, and they're up on the slide there, and I'm sure you recognize those as reasons that students would seek support or be struggling within the university environment and in their studies. I don't think there's anything untoward on there, and the things that you might recognize. I think we've met, I personally have met all of these issues for reasons for seeking support. One of the things I'd like to just have you think about in the group there is, how do you recognize people who need support? How do you personally know or find out that students need support? So we've got on the other slide, the previous slide, the reasons, but how do you actually know that? And I would like you to just to reflect on that for a few seconds, and in your own classes or your own institutions, what is it about students that make you realize that they might need some support? I'm wondering if things are going through your head, like students whose grades suddenly dip, who maybe suddenly have issues with alcohol or drug abuse, who's suddenly disorganized or late. That's a really good sign, isn't it, when suddenly people are starting to be late for things. Maybe they're looking a bit disheveled. Maybe they're very anxious. So there's lots of different presentations of people needing support. But I'd like you to actually think about that, because I sometimes think we concentrate a lot about what is needed, why people need support, but actually what does it look like? How do you recognize it? And I think it's the same for staff as well, and not just students. So what we did here in Australia is we went around the different medical schools. We've got a group called the Medical Deans of Australia and New Zealand, which has all the 23 medical schools within it, and representation. And we asked the key people within those groups, what were the key student concerns during COVID? Now, I'd like to just point out there is no surprise here that actually they're the same concerns as before COVID. So a lot of them are the same concerns, but they're just aggravated or highlighted more. So I suspect the financial hardships were there already, but in this age of jobs not being there and people not being able to work effectively, that's even become more of an issue, the financial hardship. So the issues themselves haven't actually changed. There are a couple out there. There's getting used to remote learning. So I've concentrated on that one because remote learning is something that we're introducing here, and we started to plan for. Our semester starts next week, and our students are going to be doing all remote learning. Now, I've concentrated on remote learning as opposed to on there's assessment. I think students will always get stressed about assessment. No matter how much work we put into it, we're never going to please everybody. But I think we can do something about remote learning. This is one of my favorite quotes from Viktor Frankl, and talks about between stimulus and response, there is a space, and a space where we can make a choice to do something. So the other way to look at this, or you may have heard of, is controlling the controllables, or looking at your sphere of influence. So when I talk to students and they say, I've got this, I'm stressed about the assessment, I'm stressed about X, Y, Z, we start to explore what it is about it, but also what they can control. So for example, in assessment, they can't control what the examiner is going to do. And that's what they get stressed about. And I say, you can't control it. Let's talk about what you can control. So when it comes to remote learning, there's actually a lot of things that can be helpful for students. And that's what I'm going to go into for the next few minutes, is some practicalities for students and for yourself of setting up remote learning. So this is as I like to call it, the practical bit. I'd just like to share with you, this is a cartoon of me last night. So I was making tea for the kids and on a Zoom meeting, and I answered a phone call as well. And I suddenly realized this is not a good standard to set for students and or for myself. And I have control over this. I didn't have to do this. So there are some basics to go through for what we can control for remote learning. And this is what we suggest to our students. So create a comfortable study space and eliminate distractions. I see a lot of you in the webinar tonight have got your backgrounds on, and you've put the backgrounds on from Zoom in the virtual backgrounds. And some of you have set up in your nice rooms, or you've got a lovely picture of yourself up on there. But it's a bit more than that. You've got to have a quiet space free from distractions. That's why I've actually come into work to do this webinar, because I didn't want the children to disturb me in such an important time. The other thing is about equipment, having the right equipment, such as headphones and computers and webcams. They're really obvious, but students might not necessarily have that equipment, and then financially there might be an issue around it, and setting themselves up in a space to succeed that's quiet and where they can get on with doing some work. So that's really important. The next one would be establishing a routine. For those of you that possibly have been at home, if you like, in a lockdown period, I think it could be really, really easy to get out of a routine. And a lot of people have had to actually write it down to get themselves into that routine. Now, we're doing that with our students. Some of our students coming to medical school here at Bond are school leavers, so they are relatively young, and we are going to be telling them, if you like, this is when we think you should be doing some studying, and I think that's going to be necessary for them to be able to establish their own routines. But establish a routine and write it down. It's sort of very obvious, but when you're at home, you can slip into bad habits. My children without school have slipped into a very bad habit of going to bed quite late. So I think that's the issue with working from home, is that you have to set the routine. So one of the other things we're telling students is that they will get the most out of their education by putting themselves in it more. And by that I mean participating and actively engaging in the learning and teaching. We're doing lots of education for our teachers to help them upskill in running these sessions as remote delivery to our students. But also students have to be prepared to engage as well. And I think this comes back to a lot of what Judy was talking about the moving forward with your mindset to make sure that you get the most from what's going on around you. It'd be very easy, if you could think about it in remote delivery, to sit back and not engage. But we have to encourage that, and we encourage the students to do that in chat rooms and different various parts of our technology that they get with remote delivery. Now, the second to last thing is mindset. So this is my picture of a goldfish with a shark on the top. Yeah. So mindset is everything. This links very, very closely to what Judy was saying with the growth mindset, that if you don't go in with a positive, professional, ethical approach to your learning, then you're not going to get the most out of it. And indeed, this is a great way of moving forward. We've been pointing out to our medical students that are learning remotely that that's what's happening for our patients as well, with telehealth, for example. So when students may suggest that, oh, we're not getting the most out of this and it's not helpful for me being a future doctor, we're pointing out that future doctors are behaving this way and having to because of what's going on. They're having to do telehealth, they're having to do it in an online environment or remote environment. So it is very authentic to learn this way as well. And that's about having the growth mindset. The last bit about working from home, which is really obvious, I think, for all of you, is the be patient and kind to yourself and others. we can get very frustrated with people. I don't know about you, but if people can't switch off their mic or on their mic quick enough, you're going, it's just there, just switch yourself on or off, and you can get a little bit frustrated. But showing kindness and grace and respect towards one another is really satisfying and will produce a better learning experience for all. And we're all in this together side of things. Both the faculty and the students. So this is what we've been going over with our students here at Bond. And this is summarized in this infographic here. I don't know about you, but I've been on a few webinars recently, and I've been taking photos of the things that I liked. So I'm just going to leave that a second if you like to take a photo of it. But this is just a summary of those 5 tips for success for remote learning. Now, obviously, they don't just apply to students, they can apply to us as faculty or academics. But here at Bond, what we also have is a student support services, and I'm sure you've got your own support services. And this is just basically stepped up a gear for working within the COVID pandemic. So what we have is our student support services, and this is like a preliminary for Jo coming up next, Dr. Bishop. She is our Associate Dean Saskew, who helps look after all of the students in our faculty. And basically it's a team approach with services for the students that are confidential. So we have our own on-site clinical psychologist who confidentially sees students both face-to-face, on the phone, and also on Zoom or other telehealth ways. And she is just for our students, and she does not take part in the governance or assessment. We don't know who sees her. And that has been a great help for our students, and also a great way of a barometer on our students. She doesn't tell us about individual people, but Felicity there, who is that person, can let us know when things might be coming to a head in general, or that, you're not getting the communication right, the comms right to the students. They want some more. So that's been really helpful as well. Now, the big group of people we've left out so far is actually the students themselves. They are a great peer support network. We have our own AMSA Society, which is the Australian Medical Students Association, and they have representatives in each of the universities. And they run their own mental health initiatives for students. And again, they've stepped up again during the COVID era, and they are fantastic. We are doing some co-design projects with them around helping students during this time. So these are just some of our initiatives. We have mental health first aid training here. However, that's just been put on hold because it's a face-to-face teaching, but now we're moving to a remote learning for mental health first aid training. So there's lots of different initiatives that we run and that the students co-run with us. Now, there is a little bit of science behind wellbeing for students, and this was a consensus statement that all the medical schools in Australia and New Zealand produced last year. And in that, we went through, if you like, the journey of a medical student and what could be done to help with well-being. So remembering this was pre-COVID, but the things within it are very, very relevant. So for example, one of the things that we discussed in this paper 2 years ago was assessment and well-being, and about how students were saying we would like open book exams, for example. There's been a great lot of discussion about that in the educational arena, but actually COVID has made that happen in a lot of places in Australia, and they've had to introduce open book exams because of the lack of face-to-face ability to take exams, for example. And also one of the other assessment changes is moving from a graded to a pass-fail way of doing assessment. So what's interesting to me is actually some of the changes that have come along because of COVID are the ones that help well-being of students. It's sort of stimulated them to happen earlier than they probably would have done. And the students are grateful that we are doing these things. So we have moved to an open book exam next semester. talking about having an opt-in pass-fail instead of grades in the final years. So lots of different ways to help with well-being and anxiety within the student body. There's also an excellent chapter in a book by my colleague, Dr. Bishop, and talking about well-being, and there's lots of resources for student well-being in that book chapter. So I love this picture of COVID. It's very pretty for something that's not nice. It's a very pretty picture. But what I wanted to finish on was my uncomfortableness, I suppose, in saying that this was about student well-being followed by faculty well-being when we're all in this together. And I do want to get away from the them and us sometimes mentality that we have, and that we are all in this together, and that being kind is the way we're going to get through it. This is my funny picture on Twitter where, for those of you who might know, I'm an anaesthetist, so I've had to practice my donning and doffing, but we had no masks, or we couldn't spare the masks to practice. So this is me practicing with a party hat on my face. And I tweeted that out to the student, and I also sent it internally to the students. And it was a bit about showing the human face of what's going on. And I'm just going to end on my last slide, because I've been asked this a few times. It's just very interesting to me about how I'm staying so cheerful and happy during this time. And I'm going to leave you with this slide. And I think this is why I'm so cheerful and happy right now. Thank you.
Thank you very much, Kirsty. Be happy, it drives people crazy, huh? Okay. Thank you. And we would like to also welcome all participants to ask questions in the chat room. And thank you, Judy, for responding to the questions. So I would like to invite Dr. Bishop, the Associate Dean on Student Affairs and Service Quality in the Faculty of Medicine and Health Sciences in Bonn University. Joe, the time is yours.
Good afternoon, everyone. I've been very well introduced by my dean, Professor Kirsty Forrest. So I have a couple of roles at Bonn University. I arrived in Australia 7 years ago for a 3-year adventure and decided to stay. I enjoyed myself so much, and I've got a young family as well. So I have 2 roles, Associate Dean. So as Kirsty had indicated, I look after the student welfare within faculty. But I'm also the curriculum lead and work closely with Kirsty and Professor Forrest on curriculum design and the strategies involved with curriculum design for our medical program. So when I was invited, it's a huge privilege, and I really want to echo many of the things that Judy and Kirsty have already indicated, that many of the faculty and student issues, they've merged. With a pandemic has come so many opportunities for co-design, but more the humanistic of being kind to each other and realizing we are in this together, and together we will support each other through this. So what I'm going to do is go through some of the practical elements of that were already discussed by Judy and Kirsty, and how we can implement these in our day-to-day. So you may pick and choose a couple of these practical things for your day-to-day, or you may share them with a colleague as well. So my first experience of, I suppose, how COVID-19 had derailed normal and what a conference should be was in February. I traveled to Kuala Lumpur, which I was very welcomed and had a fabulous time there. But the Ottawa conference, there was one conference called IMERI, and then we followed by the Ottawa conference. And during that time, there wasn't a pandemic. There was a discussion and concerns by certain colleagues about travel. There was uncertainty about travel and what that would look like around safety and what choice they should make. So during the Ottawa, what we found was that 300 delegates were unable to travel with an array of reasons. And part of my role there was to support the faculty delivery of a leadership course that was organized and developed by Kirsty and Judy. And so my role there was to have my training wheels on and to learn the ropes of how to facilitate this amazing leadership course. But Judy and her colleague Paul Jones were unable to travel. There was a decision made in Wales for there to be no travel. So how were we going to deliver an ESME 4-day leadership course without the primary faculty there? Do we cancel? Do we do something different? And so what we did was we came up with a new plan. We decided to wake up Judy and Paul in the middle of the night in Wales and for them to join us through teleconference. So you can imagine that came with a whole array of issues. We had another Canadian colleague who was unable to travel due to flu-like symptoms. So what was original faculty of 4 came down to me, being the only one there. We phoned a friend, we had Trevor Gibbs, the president of AME, join the team, and together we planned. So there was lots and lots of planning beforehand of how we were going to run these 4 days, who was going to do which, because the key thing was making sure that the delegates had the experience that they needed. So we learned so much from this, we decided we would take this opportunity and to share our learning with everyone. So you can see the delegates are there with Judy and Paul in the background on one of the days that we were presenting. So the lessons learned was we really wanted to ensure that everyone was in a safe environment. So as educators yourselves, when you're face-to-face or have a learning environment, you want to make sure that everyone feels safe. How can you do that if you're not in the room? If things have been disrupted, if you're aware the delegates have their own thoughts and concerns about whether they should have traveled, are they safe to return? Because at this point, some flights were being disrupted. So there was lots going on in the room, not just the activity of learning about being a leader. So we realized quite quickly that safety was paramount and communication and transparency was key, and how we were going to communicate with the delegates from day one, how we were going to deliver these leadership courses. Flexibility was needed by all stakeholders involved. So from the conference organizers who were coordinating this with us to everyone involved with the delivery, we needed to be flexible and adapt day by day actually with how we were going to run this course. Technologies, we needed the technology to Zoom everyone in the room, but we had to be realistic with what was going to work for the delegates in the room, what was going to be realistic. We couldn't have Judy and Paul wake up every day in the middle of the night. So we had to come up with a compromise of how we would actually use technology to benefit. We had to be aware of the psychological adaptation, and this is a lot what Judy has already chatted to us, those curves of crisis, how are we all going to manage and feel safe during this? And then tap into the wisdom. We really tapped into the wisdom of the collegiality and worked together of what was working. Other workshops were running in parallel, what they learned from the day before. So each evening we had a debrief of what we were going to do the next day. So we really tapped in with the wisdom of everyone around us, and including the local universities who could help us with some of the technology as well. But the key thing, and taking a breath, is that this is a pandemic, okay? You are allowed to take that breath, take that rest, take that walk. This is not a productivity contest. There is so much going on. Your to-do lists aren't getting any shorter. This is not a contest, okay? So take things easy. And I think what you'll largely hear from a lot of us already today is about being kind to yourself and others. So the key thing that we've learned from a faculty, but also with students, and I'll really emphasize what Kirsty had already highlighted around this co-design, and what we'll deliver now is for staff and students, is how to be a team remotely. You know, some of you may not have seen your team members for a while. So how are you communicating? Do you communicate? Is there regular? Do they not know when the next time you're going to chat? So make sure that you think about how you are communicating within your team. And if you're part of a team, do you know what's going on the next steps? Maybe chat to your leader or your supervisor about how unsure you are about different things. You can learn from others who've been doing it successfully. So BC, so before COVID, there are lots and lots of companies and different colleagues who have run sessions and worked in different time zones in different countries for a very long time. Learn from that network. Use the technology that is right for you and your team. So we're using Zoom tonight. Some people prefer Microsoft Teams, if you've not come across that as part of the Office suite, so Microsoft Teams. Others prefer to use WhatsApp or other telephone devices to chat and different software. but for each you can set meeting principles about being on time, for example. So this is some examples we have at Bond. We use Microsoft Teams. It is supported by our university, so that helps. And there's pros and cons to using each, and that it's really up to you as a team to decide what you prefer. So on Microsoft Teams, we can actually use chat box. You can actually phone someone. So if someone doesn't want to share their phone numbers or their mobile numbers, they can actually use Microsoft Teams to phone each other. And you can have out of office, you can say available, you can use with video, without video. We use Zoom a lot, and this is one of our medical program team meetings that Kirsty chairs, and we can have up to about 40 people chatting, and those setting of principles of how we're going to do that is really important. And Kirsty had indicated how many of you changed your background. I'm actually on campus today, so you can see some Aboriginal artwork behind me. But I sometimes have some screens from back home. I'm from Wales originally, so I have some of my castles behind me. So you can personalize yourself, and that's one way to connect to students and your peers. If you personalize your background and they can get to know you a little bit more, you can actually have days, well, this week we're going to have Harry Potter, or next week we're going to have your favorite movies. So you can actually keep in touch and make what's quite a sombering of only seeing each other on Zoom quite a fun activity as well. Some people make sure that they have their pets or their children in the background as well. So there are small group chats, and this is when we, that photo there is when we were all able to actually work in the same room together. So when you set principles, one thing that Bond University has said is for us to really consider your checklist about maintaining your professionalism. Especially, it's different if you're chatting with colleagues, but if you're in a set meeting, you may want to consider professional etiquette. And this can be from where you deliver. So as Kirsty had indicated, what your background looks like. Is your background appropriate? Are you actually looking at the webcam? I've positioned my webcam a little bit different, so I'm face on. Am I dressed professionally? I'm in my Bond corporate colors. Have I set protocols so we know that we can use the chat box today for questions? And have you got a buddy? What happens if? So before today, we sent our presentations on ahead. So just in case, so have backups when you're thinking about how you can present things. Technology, know your technology, test. So before today, we had a practice run of sharing, making sure our devices were up to date, making sure that we had a start time that we could chat beforehand. So these are all little things of etiquette that you can have to think about, and you're welcome to take a screenshot of this or look back at it later. These are really, really, really good opportunities for you to prepare yourself. If you're preparing something for your local university, have those troubleshooting IT people ready to hand to answer any questions you might have. So this is a bit of fun that we've all had a little go of, Zoom bingo. So these are the sort of things that you may have come across, those awkward silences. So these are my guilties that I've managed to achieve over the last couple of months. And it's okay, be kind. We've all had that person trying to speak without the mute button pressing, or they're not looking at the camera, but be kind. But you may want to share something like this with your colleagues to make your meetings a little fun. So keeping our channels of communication clear is really important. Again, use the most suitable for you. So Microsoft Teams has options as Teams clearly shows. You can have channels and teams. You can use chat. The key thing when you're working remotely, if you can't pop into someone's office to say, where did you save that? Where did you put that? Is to really be quite organized. If you're part of a project team, if you're doing any changes, if you're adapting any of your teaching or curricula right now, it's really important to have accessible shared drives. If that's not your skill, hand it to someone who is, but be part of that decision to make sure that everyone has access to these documents. Try to limit emails. Along with Zoom fatigue, I think we've all had email fatigue. Try to limit the amount of emails. Kirsty last week actually put an email pause and said for that week, unless there was urgent, just to limit the emails within the team, just so that we felt that we had rest. And that made such a difference. It actually made people think, is this email important, or can it wait, or can I resolve it myself? So try considering that within your team. Sorry about that. So these are the sort of things that we work on, and we've got a really good professional team member called Simone Ada, who's developed this team for us. Technologies can help, but be realistic. How many adverts or how many emails have you had your inbox advertising the next best technology? I mean, take heed that we're all getting them, but make sure that you use the right one for you and that's supported by your university. I found this poem on Twitter. So this person's written a poem of basically the first lines of every email that she's received, basically companies selling their wares of the next best online program. And then the students replied and said, well, these are the ones we're getting in our emails. So be mindful and use our Australian government. We're quite quick and developed a really good resource on online good practice, and our university has adapted that. So our tertiary education has a quality and standards agency, and that's what regulates all of our programs. So we're using this wherever possible. Our Bond University IT, we're quite quick to adapt remote work readiness. So if you haven't looked already, check what your IT service has got prepared for you. If you have an Office of Learning and Teaching, have they prepared anything? These are going to be invaluable for you if you are about to, or if you're still delivering remotely. These are going to have all the information that you need and the IT solutions for you as well. And if they're supported by your university or your institution, you can ring up and get that support. Sometimes if you go for a company that you've seen advertise and go for them, you're not going to get that support when things go awry. Our university has also developed this guide, and it really is a good e-guide for our staff to go to in preparing for their sessions. Our VC made a decision. We were supposed to have started our remote delivery 2 weeks ago. Actually, no, this week. We were supposed to start this week, but he let it us have an extra 2 weeks to prepare. And so we've all had, and Kirsty indicated, we've all been upskilled on delivery of technology. So if you're part of the team or leadership and you've made a choice to use a delivery system for your students, make sure that you practice. Yesterday, we had a bit of a giggle trying to share screens and PowerPoints and what it would look like if we wanted to put a poll in. And it actually made quite a good session. We practiced how we were going to deliver a teaching session, but it allowed us to connect with colleagues that we hadn't spoken to for a long while either. So one thing that I want to highlight and bring back to some practical elements that Judy had already covered was, what can we do? What can we do today to help us get through the various emotions that we're going through? And so Russ Harris, who developed the book and wrote the book, The Happiness Trap, he's a coach, an acceptance and commitment therapy coach, and you may have heard this. ACT is part of a plan that psychologists often use with their clients. And he developed what's called Face COVID. So Face COVID, and I'll just go through some of what that means. So the first thing, and both Judy and Kirsty had already highlighted this, is focus on what's in your control. What can you actually control? There is a crisis, there is a pandemic, we're uncertain, you may have children at home. I'm certainly got 2 teenage boys who are being homeschooled. I also have my in-laws with me who cannot travel back to the UK. So there's lots and lots of things that I cannot control. There are things that I can control. If I'm having a not so good day, I can reach out and call a colleague or a friend and say, I'm feeling like this today, and acknowledge those feelings. I love cycling. We are able to leave and take part in exercise, so I've been going cycling. So this diagram was shared by Felicity Miller, who you got introduced to earlier. She's our in-house clinical psychologist. And many of my colleagues have either got this on their screen share or as a poster in their room. And it's really important to remember what you cannot control, but what you can control is really important. So you control your attitude and how positive you are about every task that you're keen and challenge yourself to do. You can turn off your news. There's only so much reporting and only so much stats that you can listen to. Finding fun things to do at home. Finding the joy with your pet, with your partner, or with your children. Limiting the social media, although I must admit scrolling through Twitter is part of my enjoyment, something I like to do. Make sure you have your own social distancing. Do what's right for you and what's right for your family. But to ensure that you're kind and you're graceful with everything that you do. So if we were to go through face COVID, A is again, and probably we're echoing this, is to acknowledge your thoughts and feelings. These are real. We are human, not robots. So acknowledge those feelings. C, come back into your body. You know, something that you can do now is just to wiggle your toes, touch your feet, get back into your body and reconnect with your physical self. Engage in what you're doing. One thing I've noticed if I'm not having such a good day is I can be quite flighty. I'll have a number of tasks to do and not engage in one task. Set yourself realistic goals. As Judy indicated, even just one task and get that done today so you have that confidence boost. And that comes quite close to the committed action. To make sure that you do simple things, look after yourself and spend your time effectively and what you can achieve. Opening up goes back to your feelings. You know, it's really important right now to encourage your own feelings, but to encourage those of your colleagues and people around you. Really, one of the things I'd like to highlight is to use your proportions. So we have 2 ears, 1 mouth. Listen to your colleagues, listen if they don't feel, or if they're not acting as they normally would. Really make sure that you open up to your own feelings, but to others as well. Be guided by your values. Yes, there's a pandemic, but it doesn't mean that you have to undermine your values on what you feel strongly about. And that could be high standards within your university or within your team. Identify resources. This has been a key thing for us with so many resources coming at us. I joke with my colleagues that we sometimes need a bit of a trip advisor from our colleagues as to which is the best resource for which elements of whether it be the curriculum or whether it be well-being. And I'll show you some good resources shortly. And then the D is face COVID is disinfect and distance physically. That is something we can control and actually will save lives and help the community. So the I of identify resources, you already got introduced to the medical deans. So every medical school has a medical deans, and the medical deans is a membership site where resources are shared. And they've developed this suite of information for working from home, whether you're faculty or students. And it's open, so feel free to type in Medical Deans Australia and you'll take a look at this under resources and around health and well-being. So they've had a really good review of various information and what's evidence-based. The other site you may want to look at is the IMERI website, and they've put an array of free resources available during COVID-19. The World Health Organization has put a resource site together, which is really important, and I really love the Mythbusters section. So this is where people say, have you heard that? And you can go, actually, I think that's a myth, and I'm going to bust it now on who. So take a look at that. The other thing is to tap into the wisdom and collegiality of the community. So what we've done now and what your team and colleagues have done for you this afternoon is create this community, this international community where we're going to share our expertise. We're going to answer questions and that you're going to pose to us. So we've already tapping into our collegial community. So we are going to go through delayed enrollments. What will semester or term breaks look like? Are we moving all our courses online or parts of it? How is that going to happen? Is the content still relevant? One thing that's happened is a lot of innovation. So we've had a lot of our colleagues review and think, actually, what I thought was important is not important anymore. And actually, just because we've always done it this way doesn't mean that we have to keep. So we've had a lot of review of content, which has been a positive. Try not to be don't over-prescribe modules for students to do just because they're not here. Don't try and get hours and hours of modules for them to complete. Pick and choose what's correct and what's right. That's that TripAdvisor. Online assessments, that's something that Kirsty, Prof. Forrest has already gone through, and it's high on the thoughts of many of our students. Maintaining academic integrity. One area or concern that we've had from students and colleagues is the COVID-19 era. Will there be a stigma of anyone who's graduated or progressed in 2020? So we need to maintain academic integrity for everything that we're involved with. and to remember you are not alone. Okay, we are all in this together. You're going to develop a community from today, from this evening. So there is peer support. So this is us on weekly. Some of us meet weekly, some of us meet twice a week, and these are chats with peers from across the Australia. And we've just developed a student support network who are now meeting fortnightly, and we're working together. It's like as if we found our tribe, and we're working together on sharing resources. So on Twitter, these are the sort of things that you'll come across, and this is where I find my guilty pleasure, looking, tweeting, and finding out what everyone else is going through. And that's a little bit back from the UK there. So thank you very much, and I'll hand back to Ardi.
Thank you very much, Jo. Very nice presentations, and you have reminded us about that we are human. We need time to adapt, and yeah, we're not alone, and it's always important to identify resources, including trying to work from remotely with our team. Okay, now after we have presentations and sharing from our resource person in Swansea in UK and also from Australia, we're going to go back to Indonesia from Jakarta. We will have duet presentations from Dr. Vera Nindya and also Dr. Petrin. Both are psychiatrists from the Department of Psychiatry in Cipto Mangunkusumo Hospital, our main teaching hospital, and Faculty of Medicine, Universitas Indonesia. So Dr. Ada and Dr. Petrin, time is yours. Thank you. And for all participants, we welcome all questions and comments in the chat room. Thank you.
Thank you, Dr. Ardi. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. Thank you for the committee from Medical Education Center, especially Dr. Ardi, for having me and my colleague, Dr. Petrin Radayani Lukman, to be here. It is an honor for us to be here in this webinar. Today, we would like to talk about the psychological well-being of medical students and healthcare workers in the COVID-19 pandemic. Our talk is the sharing experience of what we have been done at the Dr. Cipto Mangunkusumo National General Hospital, the main teaching hospital of Faculty of Medicine, Universitas Indonesia. For those who haven't visited Jakarta or Indonesia, I would like to share the picture of our beloved campus and teaching hospital. The upper picture is the picture of our campus, Faculty of Medicine, Universitas Indonesia, with the IMERI building behind it. And the lower picture is our teaching hospital, Dr. Cipto Mangunkusumo National General Hospital. It is the top referral hospital in Indonesia. This is the content of our presentation. We are so lucky to be the last speakers because some of the subjects are already discussed with the previous speakers. As we know, the COVID-19 or SARS-CoV-2 virus has spread very rapidly all over the world since December 2019 in China and causing an outbreak of infectious disease of pneumonia. This virus has high morbidity and can cause mortality, especially for them who had comorbidity. And because of the nature of the virus, many of us experience psychological symptoms such as anxiety and also depression, just like we already hear at the opening of this webinar. And this can have impact on our well-being. The high-risk groups to experience distress are women, elderly, healthcare workers, students, and also children. Now let us talk a bit about the well-being. Well-being is a balance point between an individual resource pool and the challenges faced. It is a dynamic movement. Each time an individual meets a challenge, the system of challenges and resources comes into the state of imbalance. The individual is forced to adapt her or her resources to meet this particular challenge. There are many forms of well-being, as mentioned earlier by Prof. Judy, and one of them is psychological well-being. It is the ability to practice stress management technique, be resilient, and generate emotion that lead to good feelings. And this pandemic can give negative impact to our psychological well-being if we are not able to adapt to it. Sah and Marx once said that well-being means developing as a person, being fulfilled, and making a contribution to the community. Well-being is more than just happiness, as well as feeling satisfied and happy. Now, we know that medical students represent a highly educated population under significant pressures. They face many stressors, such as time pressure, financial debt, the need to learn a large amount of new information in relative short period of time, and the knowledge that they gain at the end of their training will be directly responsible for the health of welfare of others. And this make our students vulnerable to such mental disorders such as obsessive compulsive symptoms, attentional problems, anxiety and depressive symptoms, and perceived performance in medical school. In the time of COVID pandemic, there are some changes in medical education curriculum. For pre-clerkship students, all the curriculum change into online formats and clinical skill session may postpone. And for clerkship, all the students were removed from clerkship environment, and the challenge is to provide an authentic patient experiences for medical students as a key component of medical education under these circumstances. The impact of these changes should be addressed wisely. Replacement classes to online form could create a loss of collaborative experience that has potential to be a significant detriment to education. Cancellation of clerkship could impact on both skill acquisition as well as relationship building. And since in the time of physical distancing, almost all conferences were postponed or rescheduled, medical students and also residents will lose the opportunity for personal development through conference presentation. From the data in China, the prevalence of psychological distress in medical students is around 30%, with 21.2% affected by depression and 24.9% affected by anxiety. And now, how about healthcare workers? Since our residents will also treat COVID-19 patients in the front line. As we know, healthcare workers are vulnerable to both high-risk infection and mental health problems. They suffer from burnout and later psychological stress reaction, including anxiety, depression, hostility, and somatization. The factors that affect healthcare workers' mental health could be divided in three areas. From the individual factors, there are female, younger age, religion, education level, having children, and maladaptive coping strategy. The work-related factors are job stress, heavy workload, isolation, and exposure to patient itself. No clear job description because some of them are just volunteering, do the volunteering task, and the shortage of protective gear, I believe, is happen in every part of the world, and lack of systematic regulation. And also social factors, they are receiving stigma and social rejection from the public and experience contact avoidance, such as being excluded from social meetings. They need psychological intervention. And we found that the peer support system, psychoeducation, pharmacotherapy, and psychotherapy could be beneficial to help them. We can create the peer support system by creating a buddy system so they can look after each other without involvement of the mental health professional. And from the psychoeducation, if we know enough about what we are dealing with, we will be prepared and less anxious. So online or smartphone-based psychoeducation that provide information about the outbreak itself and mental health wellness is needed. For those who experience distress, psychotherapeutic intervention should be given. Supportive psychotherapy, cognitive behavior therapy, and mindfulness-based therapy could give positive impact for them. And pharmacotherapy could also be given based on the symptoms. Now we will share our experience in Dr. Cipto Mangunkusumo National General Hospital, the main teaching hospital of FMUI. My colleague, Dr. Petrin, will present it for us. Dr. Petrin, please continue.
Thank you, Dr. India. I will continue this presentation. We conduct mental health and psychosocial support program for healthcare workers. The program consists of 3 steps.
Dr. Petrin, can you talk louder,
Okay.
please?
Yes. Okay, I will continue the presentation. Can you hear me?
Very clear
Yes.
enough.
Okay.
Yes.
We conduct mental health and psychosocial support program for healthcare workers, and the program consists of 3 steps: need assessment survey, screening for psychopathology using self-report questionnaire, and give psychological intervention if needed. The first program, the need assessment survey, were conducted on March 22nd until April 17, 2020. And the aim of the survey was to find the needs and problems experienced by a healthcare worker during the time of pandemic. And we offer to give counseling through video call or voice call, and can give referral to mental health clinic if needed. 393 respondents fill in the survey, and we divided the result into 2 aspects: their concern and their needs. Their concerns are fear of contracting the COVID-19 virus and transmitting to family members, concern about health and well-being, regulation to seek medical help if needed, afraid of inadequate protective equipment, and worried to be stigmatized from society, and managing mental health symptoms such as insomnia, anxiety, and depression, and etc. And their needs are access to mental health services face-to-face or online, and adequate information and examinations both for physical and psychological examinations. The screening were conducted on April 24th until May 4th using self-reporting questionnaire. And there are 56 participants of healthcare workers in red zones area, including the residents. These are the results. Among 56 participants, there are 66% who tend to have mental health problems, with 43% of participants experience symptoms of depression and anxiety. 41% experience symptoms of PTSD, and 1% have suicidal ideations. We provide psychotherapy intervention, both individual and group therapy, through online. And most of the respondents prefer getting an individual therapy rather than group therapy. And in psychotherapy session, we help the client by giving supportive psychotherapy. We empathize the client's feelings about anxiety, worry, and anger, and help them to overcome it. Then we reassure and support what they have been trying to do, provide a safe situation for clients to tell story. Most of the client cannot tell their feeling freely outside or with their parents, with their family. So in this supportive psychotherapy session, they can freely telling their story. Then manage negative thoughts and feelings. Set your mindset, as our previous speaker tell to us. Then the next step, the psychotherapy that we conducted to the client is train adaptation skills. We train them to limit the access of information and social media regarding COVID-19. make a physical symptoms journal, plan activities with family, and socialize through video calls. And we also offer and train the client to do the relaxation exercise. They have to train, regulate breathing, relax the muscle, and imagine a comfortable and quiet place like in the beach or in the mountain. And then when they are in the relaxed situation, they can mention their personal sentence that are positive, such as, since today I will feel more comfortable, more relaxed, and more healthy. Yes, we hope that after psychotherapy sessions, they will have better adaptation skills and can have good psychological well-being. Now we come to the conclusion that medical students and healthcare workers are considered to be one of the most vulnerable groups to get physical or psychological impact in COVID-19 pandemic, which would give impact on their psychological well-being. Psychological intervention is beneficial for maintaining psychological well-being of medical students and healthcare workers in this pandemic, consists of peer support, psychoeducation, psychotherapy, and psychopharmacology based on needs. Online-based interventions such as online psychoeducation or psychotherapy could be done for these current situations to maintain mental health and prevent virus transmissions. I think the end of our presentation. Thank you for your kind attention.
Okay, thank you very much. Thank you very much, Dr. Eda and Dr. Petrin, for sharing our probably more contextual well-being issues in our setting. And I guess we're moving on to the QA sessions. We have already collated some questions from the participants. And I, as the moderator, also take the advantage, to ask more questions. So I hope the resource persons don't mind to respond to the questions after this. So before we move on to the QA sessions, I would like to all participants to think about what you are grateful for. So let me share this slide. Okay, so at first we asked you about your feeling, and we can we have seen that we have some happy feelings, some confusion, some optimistic feelings, some pessimistic feelings, and etc. And to move on, we would like to encourage you to also see what are you most grateful for these days, and please share with us just one thing, one word to describe it in the chat room. And we're going to develop another wordle and we're going to share it at the end of this session. Okay, thank you. Just one word. So, okay, to Judy, Joe, and Kirsty, and also my two colleagues from Faculty of Medicine, Universitas Indonesia, Dr. Eda and Dr. Petrin. Thank you very much for the presentations, very insightful. And I've been reflecting myself, and I guess all participants have been doing the same, reflecting on themselves about all the sharing from the resource persons. So we have questions, and I would like invite all resource persons to comment or to give response to, I think, the first question first. This is from our participant. She sent the questions in written through our email before the webinar. So how can I help my colleague who has depressed because of this pandemic? Does communication risk has an impact for panic action in pandemic? How effective is it? So I would like to probably invite Judy first to respond to this, and afterwards Joe, Kirsty, and Dr. Eda and Dr. Petrin. Thank you.
Okay, thank you. I think this is probably more for the psychiatrists if it's actually depression. I think what we have to distinguish between is somebody low mood because they're you know, and which would be a normal response, as I said, or is somebody actually clinically depressed? And that obviously that's a different thing. So I think if somebody's got low mood, we can do a lot of the things we've already talked about to, you know, converse, connect with them, all those sort of things. But I think if somebody has clinical depression, then obviously that's a matter for their family doctor, or, you know, even perhaps a psychiatrist or psychotherapist. So I think we have to be really careful. The more we know people and the more we talk with people, the more we can distinguish between whether this is like if I'm very low mood for a few days, that's very not me, because I'm quite optimistic and happy and blah, blah, blah. You know, so it would be different if somebody knew me. They would think, you know, she's not coming out of it. So I think that's what I would say. And I think probably the psychiatrist would echo that, hopefully.
Okay, thank you. Probably Dr. Eda and Dr. Petin, would you like to give comments on this? What the colleagues should do in this regard, if it's a clinically proven depression? Dr. Eda and Dr. Petrin? Yeah. Do you have any suggestions on what the colleague should?
This colleague is clinically proven that depression, so we have to refer this colleague to the psychiatrist, right? But as a colleagues, we can help this colleague to giving him or her the support environment. So let this colleague express the feeling and tell the story. Maybe we can find that the etiology why he become depressed. Maybe because the mindset, or thinking negatively, or she cannot see the situation, the problem clearly. So by listening to the problem of our colleagues, maybe we can help the colleagues to see the problem clearly, and we can help the colleagues to see and to help see the problems. Maybe such an instance, she has the negative thought about this situation. For instance, in our survey, they mentioned that I afraid that I will contacted my infection to my family member because I just work in the red zone. So this negative thought will come up, and if it come up with the I mean it's a more if the negative thinking is so strong, so it will impact the emotion of these colleagues. So we can help these colleagues to find another alternative thought that is more it is more reasonable. So we can help the colleagues to find another alternative thought. For instance, like, okay, you just finished work in the red zone, but when you are doing the practice in the red zone, you are using the APD, the protective and it's a the protective equipment that is proper to your situation. So when you come home, you are healthy enough, and then you can see your family. For instance, like that, Dr. Ardi. So when we have a more reasonable thinking, more reasonable thoughts, so our feeling, we are more comfortable, we are more relaxed. I think this is one from my opinion that can help these colleagues.
Yeah. So as a colleague, we still have some rooms to help another colleague who is probably depressed. Dr. Eda, would you like to add something? You're still on mute. So I'm going to unmute you. Yeah.
I think what Dr. Petrin said is already enough, Dr. Ardi.
Okay. Okay, thank you so much. And Joe and Kirsty, would you like to comment on the risk communications? What's the role? Would you think that it will be effective or at least helpful for students or for faculty in dealing with a lot of uncertainties in these difficult times? Risk communication. What do you think about risk communication in the role of risk?
I think what we've learned over the last few months is actually to communicate and to be transparent. If nothing has changed from the recent guidelines, let students know that nothing has changed. Chatting nationally to our colleagues, we've realized that we need to keep students informed, and just don't assume that because you've said it once, that's enough, and to keep reinstating and ensuring that they're aware of the communications, of the various risks, the risks to themselves and the risks to patients and their families, and to ensure that we keep on reminding them where they can seek support and advice. We can't assume that people have listened the first time. And as Judy had indicated with the crisis curve, when we're in crisis or when we're feeling anxious or stressed, we don't make we make poor choices. And so to ensure that we keep sending those reminders, checking in on people, and the fact that the colleagues even notice that someone is different is a good thing. So is that okay, Hardy?
Yeah, thank you. Thank you, Joe. Kirsty, do you want to add some more?
No, I think it's all been covered.
Okay.
One of the other aspects of communication I found interesting is describing risk, as you said, but as a more some students, and I don't know if it's come back to that perfectionist stream that we're talking about in the chat, they're asking for absolutes, and there is no such thing. And that's very interesting to think through about how they're going to progress in their careers if they are wanting absolutes now. It's very interesting. They want to be absolutely sure that they won't catch anything and absolutely sure that they don't pass on to their relatives. And they want us to guarantee that and things like that. And it's a very strange language in healthcare. And I think it's an interesting concept that are coming through with some of the students, and they're very high functioning. And I wonder if it's a little bit to do with that. So that's one of the things I'm taking away and thinking about.
Okay, thank you very much. The second question is probably I would like to direct this to Judy. You share about the reaction and the adaptation process. So this is a question from Dr. Zarida Hambali. With COVID-19 pandemic occurs suddenly, one will react differently and take times to adapt. How we can ensure the response is appropriate and in short term, and especially for students. So probably all resource person can also respond to this question. Judy, would you like to comment first?
Well, the short answer is we can't, but the longer the longer answer is I think what we have to do then is acknowledge that people go through this curve, and they might go through it multiple times, even in a day. You know, I do. I go, oh, it's all right. No, it's not. It's so I think acknowledging it's the first thing, but I think what we can do then is put things in place for our students and faculty and ourselves. Actually, it's everybody who's a human being. It's actually putting things in place. So structure, routine, their certainties. In the chat, we've been talking about certainty, and so did Kirsty. It's a human need that people want certainty. As I said before, they want that safety net. So I think for us, it's providing the safety, the structure, the routine, being certain about what we can be certain about, and acknowledging the things that they will have that we don't know yet or we haven't sorted out yet. So I think that structure is really important. I know one of the things we did early on with ours, our university closed on the 19th of March, and we had a lot of teaching. I run the master's course in leadership here at Swansea, and you know, one of the things was me thinking quickly about, okay, how will the rest of the term elapse? What will happen? And telling the students, okay, this is it. I need to sort out, you know, your assignments and things. So it's actually, and this is the structure. Go onto Blackboard, look at what you need to be doing week by week, come back to me. So I think we have to do that. And then as they start to come out of the curve a little bit, then we have to think about those other needs around achievement and variety and stimulating them to come up to the other side of the curve. Okay, so that's what I would say, is just keeping that in mind. But actually, you know, people need you know, we need that. And I see Kirsty's put, you know, saying we don't know. It's not a usual medical term. And I'm lucky all my students are practicing health professionals, so they're grown up. So I can say, I don't know, but I'll find out, you know, so we do that. And I think, you know, we've just got to do that. And somebody said, give people time, absolutely. But for students that, you know, they want that certainty, don't they, about when their assessments would be, what will be the impact on my program? How will it affect me? It's me. That's what they want to know. So the more you can do that, I think is helping them to move through the curve. That's the best I can say, really.
Okay, thank you. And for probably for Dr. Eda, Dr. Petrin, Joe, and also Kirsty, I would like to address further questions on actually the role of the environment and the role of the peer supports to foster the positive thinking and to maintain or foster or encourage the well-being. So what is your comments on the role of the environment, the peers, the family in making ourselves keep sane or keep having positive thinking in these difficult times? Any comments on that?
I'll go first.
Yeah, thank you, Joe.
With regards to peers, we are students. We're a 5-year program, and so our years 4 and 5, even though there's been a little bit of disruption, or to them a big disruption, many of them have been able to maintain clinical placement time. But for our junior years in in years 2 and 3, they've actually been away from campus and away from this routine for quite a long time. And so what we did quite quickly was actually engage with the student reps. So if you've got a student society, which most universities or colleges do, if you've got a student society, engage with them. So our Dean of Medicine, so Kirsty Forrest, she actually has a really good relationship with the president, and then me as the associate dean, I speak to all the class reps for all of our programs across the faculty. And what we've done is engage with them with, well, because they've stayed in contact via the various social media, what can we do to help? What are the frequently asked questions to sort of reduce any anxiety? And even though we could say it's on the website, that's not good enough. So wherever possible, we've engaged in conversations. We run webinars. So we hosted a webinar last week that was chaired by our dean, by Kirsty, where we had over 200 plus students, and we prepared beforehand. It was a bit of a Prime Minister question time where the student reps had put questions together that we were able to review, and we collated those and were able to go back and feedback with transparency. And many of the answers were, we don't know. What does it look like? What does clinical skills? Are we going to able to get back onto placements in the junior years? So we were able to show our faces and answer the questions and not just be behind a keyboard and an email and a memo. And I think that has really showcased that support. From that, we've also developed peer support, where students in second year will now, the incoming first years who've never met us, have never met each other, are joining us, trusting us to join us in May, and they're going to have a buddy. They're going to have a peer, a mentor in the second year who are going to be there and ask any questions, because it's the same questions. Which is the best book to use for anatomy? What's the best histology book? You know, what's the best stethoscope to buy when I return? So these are all the things that are still questions these first years are going to have. So a peer support structure is really important. And we've heard nationally from our colleagues that there are different types and models of peer support. So in our student support network that we've set up in the last month across Australia, on Tuesday, colleagues from Adelaide, so South Australia, presented, no, sorry, it was Canberra. They presented how their peer support worked. And the way it works is it's run by the students, but it's supported by faculty because students' roles change. And peer support can work in hospitals. We have junior doctor supports. So I think the peer support of I've been there, I get it, really, really resonates with a lot of our students.
Okay, thank you very much. So Kirsty, would you like to you share in the chat room about the learning coach for students in the clinical clerkship?
Yeah, so thank you. The clinical years have carried on with an experience that wasn't as good as before, I don't think, as in the end of rotation. Some of the rotations have had to go down in preparation for COVID, which fortunately, and we need to fingers crossed, didn't actually arrive. And we were concerned about the experiences the students were getting, and we just suddenly went, we've been wanting to do learning coaches for a while, and we set it up very, very quickly. This is the positive, I think, from COVID, and one of the things we're talking about, having the positive mindset or helping people come up the curve, as Judy says, is to put spin on the positive. We've got so many positives out of this, and it always sounds a bit bad talking about it in such a dreadful situation, but the positive is if we got things done that we wanted to do anyway. So we've got volunteers, as in recently graduated alumni, and also faculty, but all medical doctors, to put themselves forward to volunteer to take 4 students on and ring them and chat with them purposefully every 2 weeks, and about how they're going in their learning and how they're meeting their competencies and how they're getting towards graduation. And it's been great. The comments we're getting back from the coaches and from the students is this is fantastic, and they're feeling very valued and very looked after. And so that's the positive spin for me. This hasn't cost us anything. We've actually asked for volunteers to do it. They're doing it in their spare time. And it helps us feel that we are looking after the students. And eventually we want to go towards a coaching model that would be about career preparation and things like that. But we've been talking about it for years, and then all of a sudden we got to do it. And it's just the optimism of that. So some of the people that I find maybe are a bit down, I go to them and say, look, see this as the opportunity, see this as the opposite of what you think, and what can we do that you've been wanting to get done, because we could try and get it done. So we've been talking about how we've moved from could or should we do something like remote learning to now how do we do remote learning. So it's that movement from could or should to how that I'm really, really living in the invention and creativity that we could do as medical educators. And that's what I'm loving. And what I'm also loving, and it always sounds a bit weird, doesn't it, is the way a crisis pulls people together. So our team has been the most functional it has ever been, getting through a crisis. So we're living off each other with the optimism and appreciation. And I wouldn't, if we weren't doing that in a team, I'd know I would be down. So that's what I do, and that's what we do with the students. So it's all one big environment, hopefully, of optimism and creativity, which we're loving.
Thank you so much, Kirsty. So further questions is from Damar, one of our students. Thank you, Damar, for joining us. So Damar, question is on the, sorry, not this one. Okay, the best way to support the healthcare workers is there a plan to train the healthcare workers to provide peer support to psychotherapy? I think I would like to direct these questions to Dr. Eda and Dr. Petrin. Dr. Eda and Dr. Petrin?
Okay, Damar, I agree with you that this is the good idea, because by teaching the peer to do the technique of supportive psychotherapy, for instance, or doing the counseling, so the peer can help the peer itself. So I think this is a good idea. We already done this training to peer support in the medical school students, undergrad medical students, I mean. So we teach them to do the counseling and to do the supportive psychotherapy so they can help each other. I think this is the good idea. And in Cipto Mangunkusumo Hospital, so we are planning to do this to do the training for the peer, so they can support each other in the working environment.
Thank you. Dr. Eda, would you like to add some more?
Yes, thank you. I agree with Dr. Petrin. One of the best methods to provide healthcare, mental health care for healthcare workers is the peer support, because sometimes they are not eager to talk to strangers, right? This is what we learned in the counseling program that we conducted. Many of the residents do not willingly want to share their fear or their anxiety to us. Maybe one of the factors is because they don't want us to know that their weakness, or maybe they are afraid that it will give a bad impression about them. So with peer support, maybe they are can be more open with each other, and they can look after each other. And if the problem is severe and cannot be addressed with the support system, then they can go to the expert to seek for medical advices. I think that's all, Dr. Ardi. Thank you.
Okay, thank you so much, Dr. Eda. So further questions, I think, let me share the PowerPoint. So this is, I think this is real, these questions from Dr. Adlina Sulaiman. What about the students who are poor, isolated with poor access to telecommunications and without peer support that they get used to get when at campus? How we can assist them? Joe, I would like to have your comments on this.
Yeah, this is something that we've been discussing at Bond. We are a private university, but we're not for profit. So we need to ensure that all students and all their circumstances are considered. So one thing that we've realized during the lead up to the commencement of our semester is, what can we do and how can we ensure that all students are aware of the support that's available, and what about if they're not engaging? So what we've done as part of our training for our educators is to look out for early warning signs. So the first thing is to make sure that your educators have a class roll list. You know, has everyone who is enrolled in the class participated, turned up, logged on, communicated, emailed to you? Because the only way you're going to know about disengagement if they're not engaging. So if you haven't had any engagement within the first week or a bit, what would you do? And that's where some of those issues may come up, is that when you actually reach out, whether it be phone or email, and you don't get it could be because of those issues there. That's when you need to make the decision, have those conversations and share decision with those students about whether studying and continuing the study is appropriate for now. Don't rush into a leave of absence or a break in study, because that might not be what they want to do. But it should be part of the discussion that you have, that their circumstances right now do not allow them to travel and to come to university where part of their scholarship or accommodation would have allowed them to. So how can we ensure that they can fully immerse in the content that's being delivered this way? It could be that it's appropriate for you to support them by having things sent to them or have additional sessions. And I think you cannot, not one answer is going to be appropriate for every student. So I think what we try to do, and if resources allow, is to have that one-on-one, that personalized approach with the students. And that's where the learning coaches have helped us in the latter years, is to define what are the student needs for that particular student. Because if we had a whole cohort approach, it just wouldn't be appropriate. So depending on the student's circumstances, perhaps a pause in their study, but we always worry that if a pause happens, will they ever get back? So really consider and perhaps have a support team to have those discussions and decisions with them.
Yeah, thank you, Jo. And I think it's we only have 10 minutes left. So there's a question from Kirsty. Is there mental health first aid training elsewhere? Anyone knows about mental health first aid training elsewhere? I think in WHO website there are some training materials that we can actually use, but I'm not really sure about the whether there's some training really focusing on mental health first aid. Anyone wants to comment on that?
Dr. Ardi?
Yeah, please, Dr. Eda.
Yeah, actually in Indonesia, there are several training about mental health first aid regarding the
Plan?
Disaster. Disaster. We also try to access this training before, when, as you know, as Indonesia, we often get a natural disaster, and but I don't know the specific about COVID-19 now, about the mental health first aid, because what we have learned, the approach that we can use in the natural disaster, in the mental health first, what we have been taught in mental health first aid cannot be used in this kind of pandemic, such as we might use the breathing before and after we deal with the patient, contact with the survivors. Right now, because of the social distancing and the use of the protective gear that not allow us to move freely, it cannot be done. So there are specific issues that we need to address during this COVID-19 pandemic. So we have to make some kind of adjustment, because not all the material from the first aid mental health training that we used to use cannot be used right now, Dr. Ardi.
Okay, thank you very much. So I think thank you, Kirsty, for sharing some resources in the chat room. And we have also our participant who already shared, Dr. Salma Kiana. Thank you so much. Some courses in the Coursera on the psychological first aid that can actually be accessed. So probably we would like to use that formally or informally in our institution. It will give us more tools to help the faculty as well as the students. So the final question is about if all of the lockdown and current regulations around COVID-19 transmission prevention is gotten off. So is it how we would prepare ourselves, our faculty and our students to come back to is there a new normal or come back to the normal before COVID, or so is there any comments? And I would like to also invite all speakers' final remarks to what we need to prepare so that we not to avoid the uncertainties, but what is there anything that we can do to prepare ourselves and our students to face probably another uncertainty in the future in regards to coming back to the normal after COVID? I would like to invite Judy first, probably, and including your final remarks, Judy. Thank you.
It will never be normal again, I think, is what I would say. We won't go back to how it was before. I don't think we can. So what I would say is we need to go back from a psychological perspective. We need to go back to the basic needs, physically safe, making sure that there's some certainty about what we can offer, but also acknowledging that we have I think as leaders, we need to give people the reassurance that if things change, we've got a plan. You know, we know you're safe with us. That's something that we have to assure as much as we can, but we can never assure proper safety. So I would say, and we're thinking about this ourselves, and we've got a meeting later today about this, is how do we get back to how do we start to get our students back on campus? For my course, I'm going to keep it online because I can, and it's already blended. But, you know, that's what I would say. And my final thoughts are that psychological well-being is complicated. Maintaining it is different for everybody. And people will go, although we have these human responses which are common to all of us, people move through them in different ways, and it depends. Our resilience, our grit, our emotional intelligence, all these things vary, and I think what we can do is have some of the tools to recognize what people are going to help nurture resilience and that sort of thing, but also to acknowledge when people are struggling, and that's about conversation, communication and connection, and that's what I would say.
Thank you, Judy. Conversations, communications, and connections. Thank you. Kirsty?
Hi. Gosh, well,
Sorry.
yeah, I'm not actually a fan of the words "getting back to normal." I think that's the problem, isn't it? And get back and back to normal. It's all backward looking, and we do have to, in a little bit, look at what we've done. I think what we need to do is look at what's gone well, as in the opportunities, and there are some things that we thought, why haven't we done this already? We should have been doing this already. So taking those opportunities and going forward. And one of the things we haven't picked up on in conversation is somebody asked about how to improve their positive mindset. And the biggest thing for me, and there's lots of exercises you can do, is what you've emphasized during this talk, which is sharing what you're grateful for and doing that and being grateful. So my big thing is I am grateful. I'm grateful to be here, and I'm grateful to be healthy. And I'm going to look and see what the opportunities are and keep moving forward and not talk about normal or back.
Thank you. Thank you so much. Jo?
Hi there. I totally agree. The innovations that have happened during this time have it's been a privilege, very challenging, but it's been a real privilege to be part of some teams, and really proud of the people I've had around me to support and role models. Our DVC academics, Professor Dunstan, she often says, we're never going to go back to how we were, and that's a good thing. So taking advice, and what I always say, Ardi, is, it's okay not to be okay. Find who your peers are, who you trust, find someone you can share. We've now all got an international peer group of supporters of sharing information. Use those resources, use this evening's or this afternoon's discussions to learn from. You don't have to do it all. Somebody's probably already done it or thought about it. Use these peer networks to help you and your team. And yeah, I think we're bouncing forward and joyfully with the new era. We have got international colleagues who are in different circumstances. We are a little bit different in Australia. We are in different levels of going back to being able to be a little bit more physically social together. But during this time, although we've been physically not together, we've also been able to stay socially connected, and that's been really important. So if you haven't heard from anyone for a while, or you're worried about anyone, my last bit of advice is reach out to someone you haven't spoke to for a little while, whether it be a family member or a colleague.
Thank you very much, Joe. I like the remarks on bouncing forward. Thanks. Dr. Eda and Dr. Petrin, would you like to share your final remarks or final comments?
Thank you. I agree with all the three speakers earlier. Maybe we will never go back to our normal, but we have to be ready for our new normal. So what we can do is look after each other, keep our positive mindset, accept the change and be part of it, and move forward with our new normal. And hopefully we all will have a good psychological well-being. I think that's all, Dr. Ardi.
Thank you so much. Thank you so much, Dr. Eda. I totally agree with you. Dr. Petrin?
Yes, thank you, Dr. Ardi. I agree with Dr. Feranindia that we have to adapt to this new normal because we cannot move to the previous situation. So what we need when we have the changing situation, we have to adapt and be more flexible. And then how we perceive the situations based on our thought or our mindset. And our thought and our mindset to the situation will impact to our emotion and our behavior towards the situation. So we need to manage, we need to train our mindset and our thought toward the situation so we can have a good well-being, we can have a more good feelings and we can adapt or we can be more flexible in the new situations. I think that's things that I want to tell to you for the audience. Thank you, Dr. Ardi.
Thank you very much. And thank you very much to all speakers. I think it's been very insightful webinar. And I do believe that all participants, I myself feel that I've been reflecting all along with all of the speakers and raise another level of awareness of the importance of well-being. And I would like to share our final wordle. Thank you very much for participating in this. And yes, this is our way to bounce forward. So this is what we've been grateful for. And I would like to close these sessions by saying thank you very much to all resource persons and of course to all participants. You've been wonderful participants, giving us a lot of comments and a lot of new contributions and new understandings on the well-being of the faculty and of medical students and health profession students in these difficult situations. So with that, I would like to close this webinar. And to all resource persons, I would like you don't mind to stay a little bit longer, around 5 to 10 minutes, because we're going to have a debriefing sessions after this. And to all participants in the chat room, we have already shared with you the details of the, if you would like to access the presentations, the PDF files of the presentations of all resource persons, as well as the video, you can access that. And to those of you who would like to have a certificate of attendance of this webinar, please also access the questionnaire and connect with us in the provided emails. So I would like to close this webinar. Thank you very much, and our best regards from Medical Education Center, Indonesia Medical Education Research Institute, Faculty of Medicine, Universitas Indonesia. Assalamualaikum warahmatullahi wabarakatuh. Selamat sore. Thank you very much.